Hello and welcome to Dateline Lagos on Channels Television. I'm Ayo Tunde Balogun. Coming up on the program, Governor Sanwo-Olu commissions primary healthcare center at Amuwo-Odofin local government area. State government launches secondary school eye health program, and state government bans amplifiers at motor parks. Let's get the program started with the commissioning of a new healthcare facility by the Lagos State Governor Babajide Sanwo-Olu at Amuwo-Odofin local government area of the state. He also assured the people of delivering the Lagos-Badagry Expressway before the end of the year 2022.
The Lagos State Governor Babajide Sanwo-Olu arrives at Amuwo-Odofin local government area. This is his first visit to Festac town, and residents of the area troop out in their numbers to give him a rousing welcome. He's here to commission a primary health care center named after Senator Oluremi Tinubu. And the chairman of Amuwo-Odofin local government area is grateful to the government for bringing healthcare service closer to the people.
The automated PSC designed to serve as military hospital possesses the following features: male and female wards, delivery wards, laboratory diagnostic lab, mini theater, tuberculosis/HIV screening rooms, consulting room, nurse and doctor rest and changing rooms, medical record units. The word automated used in qualifying the project succinctly describe the state-of-art medical equipment already installed in advance to global best practices for a medical facility of short status, which also include a functional dedicated electric transformer and also an alternative standby 24/7 power supply. Generating set. The PhD was built with no loan incurred in the name after Senator Oluremi Tinubu in recognition of her exemplary passionate contributions to child development and her several children-oriented programs and initiatives from her time as the First Lady of Lagos State, when our national leader of all political Congress, Oluremi Tinubu, was the then governor of Lagos State.
The chairman of Oriade Local Council Development Area and other community members asked government to address all bad roads within the community.
We need your support, sir. We are calling on you, sir. Yes, sir. That we want you and this media to draw your attention on the bad road, on Odojo Road, sir. We are begging, sir. We want road in Ibasa Ibeshe Road, sir. We want a leak road in Elisha Amore Road, sir. We are begging you, sir. Please help us, sir.
We have seen the lot of things you have been doing in all local government, bridges in Ojokoro, Agege, and all the rest of it. Your coming here today is to put a stamp of your activities on what you have been doing in Lagos State in Amuwo-Odofin. But let me say one small thing. This edifice we are commissioning today, the local government itself was, before it became a local government, was a mini clinic created by FHA. So, but at the Irekefe Commission in 1996, this place was created in 1996. This place was chosen as a local government council for Amuwo-Odofin local government, which is Amuwo-Odofin and Oriade then. We want to thank you that we are increasing what was a clinic now to an hospital. But we want to add that when you make that one an hospital, you must help us to improve on our road around Festac town, because it's a mini Nigeria, as I've told you, roads around the Festac town, so that Festac will come back to what it was when it was created in 1990s.
The Irede Road, Irede Abule-Osun Road, which has been under construction for years, you have stamped it that it has to be done, and it has to be done now. The Mumuni Adio Badmus Road, which has been crying for attention for years, you have said it will be done, and it has to be done now. The same thing with the satellite, Navy Town. You said it will be done, it has to be done now. And the popular road, which is making everybody crying, which is the Old Ojo Road. I'm aware that this road has been approved. And governor has promised that it's going to be done now. By the grace of God, all the good works which you have intended to deliver to the entire Lagos State, God will make it possible.
Governor Sanwo-Olu responds to their plight and assures the people of more development in the area of education and completion of the road projects along Lagos-Badagry Expressway by mid-2022.
It is clear to me that our demonstration of progressive governance, which our great party, the All Progressives Congress, stands for, is truly working in Amuwo-Odofin and Uriade local government. The commissioning and handing over of this PHC is a demonstration of our modest achievement that is entrenched in our team's agenda of our administration to prioritize quality health facility for all of our citizens. With regards to road infrastructure, I'm sure they've shown you that we've taken the very difficult choice. We're currently rebuilding the Navy Town Road, which is just across the express road there. This road will connect the old Ojo Road, and it connects to the CBN training school and also to the very important Navy Town installation, which is critical for security and peace in this neighborhood. I know how important this road is to the people of Amuwo, and I want you to know that by this time next year, in fact, before the end of this year, you should be handing over this road as a brand new road for you. There's also the important Lagos-Badagry Express Road. I'm sure it's an important road for you. From Igomu to Okokomaiko, the stretch on the Lagos-Badagry Express International Road is already receiving extensive construction, and we're believing that by the middle of this year, the road construction to Okokomaiko will have been completed. This is 22 kilometers of 10-lane highway will be completed. This road cuts across from Surulere to Ajeromi Felodun, to Amuwo-Odofin, to Ojo local government. And we're believing that all of this will be to the benefit of our citizens. Right now, when our government took over, that road was about 40-something%. Now the road has reached about 85% construction.
As the state government commissions the new primary healthcare center for Amuwo-Odofin local government and Uriade LCDA, residents of the area have been advised to make good use of the facility and get quality healthcare as fast as possible.
We are still talking about healthcare. This time, the Lagos State Ministry of Health has launched the secondary school eye health program to help reduce visual impairment among pupils in the state. Take a look.
Cataracts, glaucoma, and refractive errors are some of the most common causes of visual impairment in Nigeria that could lead to blindness if not treated on time. Cataract tops the list, accounting for 66.2% of blindness cases and 80.7% of severe visual impairment. It's followed by refractive error and glaucoma. In Lagos State, awareness is being created among youths on preventing long-term eye issues with the launch of the secondary school eye health program to detect eye defects early. The first set of students to get tested attend Oregun Junior High School in Ikeja.
The school eye health program is one of the strategies of the Lagos State Ministry of Health blindness prevention program to reduce the burden of childhood blindness as a cause of avoidable blindness in the state. The school eye health program was launched in the year 2006, during which the blindness prevention program team moved around the primary schools on the Ibile basis, the divisions of Lagos State, to carry out eye screening for the pupils. I'm sure I don't need to tell many of you how many students seem not to be doing very well in school, and they seem to be dull students, only to find out that the real problem is that they have a refractory problem and they really can't read from a certain distance. And then once they get eyeglasses, usually that resolves and they tend to do very well. The scope was expanded in 2012 to include training of teachers and installation of vision screening board in all the state primary schools. Till date, the primary school eye health program has reached out to 235,515 pupils, and 2,178 glasses have been distributed. A total of 2,002 teachers were trained, 1,001 schools equipped with vision screening kits, and 859 vision corridors installed across primary schools in the state. In a bid to further address the burden of visual impairment and for better coverage, we've started the training of teachers in junior secondary schools as well. This training of junior secondary school teachers commenced last week and will be ending next week. 306 teachers will have been trained, and 175 vision corridors would by then have been installed. I think it's also important to mention that beyond the eye health program, the school health program also has a dental component. It has an oral component where oral for mouth, oral for air, AU oral for air, and it also has now a mental health component as well that we're taking to all our schools.
The Eye Health Initiative has trained over 300 teachers on vision screening, while eye screening boards have been installed in all public secondary schools across the state.
We teachers were trained and were able to detect some students that have serious visual impairments. And today, they'll be given glasses so that it will stop them from having more complications.
For the past 4 years, I've been having these eye issues. So my mother took me to a free medical checkup, and they asked my mother to bring some amount of money, but she could not afford it. But I'm here to thank Mr. Governor, Minister of Health, and the commissioners for giving us these glasses to enhance our sight. May God bless you.
The Eye Health Program is one of the strategies of the government to prevent blindness from childhood.
It's important for us to invest in you and to make sure that we're producing the next generation of students that we can rely on to keep Lagos State the center of excellence. It is for this reason that we're introducing these health programs, these screening programs, because eyesight and hearing are one of the most important senses that you can have. Without good eyesight or good hearing, there's no way that you can normally understand what is going on in your schools. And therefore, it's important that we are giving every child, a child can be a genius, but if you can't see or you can't hear, then we're robbing that child of the opportunity, and we're robbing the community of the benefit of that child's genius. For children who have eyesight defects, and that's the commonest form of inability to see or a form of blindness, so we're here to change your lives for those of you that have eyesight defects, so that you can become the best student and that you can bring out all your intelligence and your genius. So I'd like to thank the governor, Mr. Babajide Sanwo-Olu, for driving these programs, and we're going to push them across as many schools as possible to make sure that there are no students that are lagging behind in education and not being able to contribute to the growth of this great state simply because you didn't have access to glasses or a hearing device.
And from the Ministry of Education is a promise of continued collaboration with the Ministry of Health to ensure good mental learning is achieved for students and teachers alike.
Sometimes you find students not performing well in the classroom, not because that child is not intelligent. It could just be a simple problem of refraction. And as parents sometimes, or even as teachers, because of the level of our understanding and enlightenment, we tend to equally add to the burden of that child, maybe flogging that child. You know nothing, you know nothing. Not knowing that, not that that child does not know anything, but because of the distance between that child and the chalkboard. So, eventually it will be now found out that that child has eyesight issue. But today, the Ministry of Health want to bridge that gap such that we don't unnecessarily burden our students with, our comments of you don't know anything, you can't see from that place. So when we detect all this early enough, then the intervention becomes easier.
The screening process ends with students who need to correct some eye issues to receive their glasses. Teachers are also presented with the vision screening kits. The next line of action, according to the Lagos State government, is to install vision corridors in all public schools across Lagos State.
Dear Lagosians, the deadly coronavirus pandemic is here. Its new strain is easily transmitted and deadlier. Coronavirus symptoms are fever, dry cough, tiredness, difficulty in breathing. We can all prevent the spread of this virus through appropriate and regular use of face masks, avoiding close contact with people who are at high risk, washing our hands regularly with soap and running water, especially after visiting the toilet, before eating and after coughing or sneezing, using alcohol-based hand sanitizer, maintaining at least 1.5 meters or 5 feet distance from anyone coughing or sneezing, covering our mouths with tissue while coughing or sneezing, and thrashing the tissue. If you feel unwell and show symptoms of coronavirus, or you notice anyone who does, please call the Lagos State Emergency Hotlines 08000 ECOMED or 0803 3356 5529. Many are dead. Don't fall victim or die in ignorance. Report now. Together, we will overcome this challenge. Igbega Ipinle Eko, Ajumosheni, Lagos State Government. Announcer.
Now to transportation. The Lagos State government has banned the use of amplifiers to call passengers in all motor parks in Lagos State. Now, the special advisor to Governor Sanwo-Olu on transportation, Toyin Fayinka, says a monitoring committee has been set up to enforce the law across the state.
Lagos State is a beehive of activities. One thing that's constant on a daily basis is noise pollution. Noise pollution is not only a nuisance, but a serious environmental and health hazard that leads to deafness, sleep disturbance, high blood pressure in some instances, mental fatigue, among other issues. As part of efforts to reduce the effect of noise on residents, the Lagos State government has banned the use of amplifiers to call passengers at motor parks. This decision was taken by the State Environmental Protection Agency in collaboration with the Ministry of Transportation. The special advisor to Governor Sanwo-Olu on transportation says a monitoring team has been set up to enforce the law.
I'm coming forward with the assurances that we at parks, we are happy to be operators at parks. We are very, very happy. That is a sector that no one in the world can do without. Movement of goods, movement of human is being done at our garages and parks. So we are very, very dear to you as you are dear to us. Essentially what we are saying today is parks in Lagos State has accepted willingly to address strictly to the policy. It might interest you to know that the first set of people throughout Nigeria that will give you these assurances are our motor parks. So I challenge other areas, churches, mosques, and those of us that do party, we comfort ourselves by discomforting others to take a clue from we. We call us Agbero. We are very, very passionate about it. But you could see now, you are the one that are obeying the law. So, by the grace of God, we will make sure we obey your rules. And anybody, we are law-abiding anyway. By this declaration today, I am empowering the parks monitoring committee, which happens to be under me also, not the office of special advisor, to go out to all the parks in Lagos State as from tomorrow, anywhere seen to be using any object that could generate pollution, dealt with in accordance with the law. So, Ministry of Health, LASEPA, you have our assurances.
According to medical experts, noise pollution has affected about 8.5 million Nigerians who now suffer hearing impairments.
WHO has informed us that if action is not taken, by the year 2050, it's going to rise to about 900 million. Nigeria has a share in this, and what is the share? 8.5 million people in Nigeria have a disabling hearing loss. So when you see some people out there, they are carrying about an impairment, but they do not realize it. Now, at the behest of LASEPA, we did a small study on those people who work at the park, the drivers and some of the conductors. We were able to come up with few figures. We were able to screen 30 people on that particular day. Out of these 20 people, we found that 5 of them have a very severe hearing loss, which is 17%. 17% is quite high. That's just for one park. And we also found out that 13% of those we examined had wax blocking their ears. And when wax blocks the ears, sometimes they miss sound, sometimes, perhaps that's the reason why some of them blare their horns excessively so as to be able to hear something.
Prevention is cheaper than cure, which is why we are driving this advocacy here, to say that if we can reduce the noise levels, we can reduce the impact of permanent hearing loss, we can reduce the impact that will have on our health, we can reduce the impact to have on our mental health. And interestingly, it also has a huge impact physically on children as well as the cognitive development of young people. So reducing the level of noise has a huge difference in the way we live our lives now. And hopefully the projection that by 2050 becomes as much as 900 million is something that we can avoid. Because that also would say that in Lagos or in Nigeria as a country, we are looking at as many as 50 people. So for 8.5 million people, it means 1 out of every 24 Nigerians has some form of hearing loss. And so we need to deal with that now. So one of the strategies that we're looking at as the Ministry of Health is to leverage on our motor park health and safety program in conjunction with decibel hearing consultants to also include hearing screenings, not just as a tool for advocacy, but also as a preventive tool to help us identify people who are dealing with hearing loss and also provide some form of measures to intervene and provide care for them.
LASEPA reads the Riots Act, and the Ministry of Environment is set to ensure that noise pollution is reduced to the barest minimum.
It is a public offense in Section 197, subsection 2 of Lagos Environmental Protection Agency laws to use an amplifier, loudspeaker, public address system, and music, or anything louder than a certain decibel to propagate your beliefs, advertise your goods, or even call passengers. And what is the fallout of this? There's fine, there's jail time, and as we have heard from the Special Advisor Transport, you may even lose your business. I will talk specifically about motor parks. If the decibels exceed the allowable government decibels during the day and during the night, the penalty is a fine. they can be taken to court in the absence of not paying fine, and repeated offenders will go to jail.
Noise pollution is the most prevalent of the complaints received annually, accounting for 75% of total complaints. These are mostly anthropogenic and not limited to transport, religion, commercial, industrial, entertainment, power generating, among others. Agency receives and processes petitions and complaints through an interactive website and a few hard copies too. These are treated times without number, without any physical appearance, but our men move to sites where the complaints are made and they resolve the issue, most times amicably. But if we see a recalcitrant type of people, that's when it comes to sealing of the whole place. City noise control will further enlighten the general public on the harmful effects of noise pollution on hearing and human health, bring about self-regulation amongst the various players.
Going forward, residents are advised to report cases of noise pollution to LASEPA via its website www.lasepa.gov.ng.
This is where we call it a day on the program Dateline Lagos. As always, thank you so much for watching. I'm Ayotunde Balogun. Till we come your way again next time, stay safe.